And now I'd like to introduce our first keynote speaker for the morning, Dr. Jonathan Mermin. Certainly the coronavirus is on everyone's mind, and it's been impacting not only us on a personal level, but all of our programs and all of our organizations. And that's why we've invited Dr. Mermin to join us this morning. Dr. Mermin is the director at the CDC of the Center on HIV, Viral Hepatitis, STDs, and TB Prevention. And we asked him if he could join us today, and he's taking time out of a very busy schedule as he addresses the coronavirus for all of us. Dr. Mermin is a Rear Admiral in the U.S. Public Health Corps. Before that, he was director of the Division of HIV Prevention at the CDC, also known as DHAP. And he knows a thing or two about pandemics because he served as director for the CDC of Kenya and also as a public health attaché in Uganda. He's a graduate of Harvard and the Stanford Medical Schools, which should be enough for all of us to appreciate his expertise. But we who know him and love him refer to him as Jono. I can tell you that when I called Jono about a week ago and asked him if he would speak to us about what the HIV community needs to know about coronavirus, he got back to me in literally 1 minute. And he said, Jesse, I really want to do this. So speaking to us from his home in Atlanta, please welcome Dr. Jonathan Mermin. Jono, over to you.
Thank you very much, Jesse, and Kenyon Farrow for inviting me to talk about coronavirus and HIV. We're in an unprecedented time in the country and the world right now, as people have already talked about this morning. And I've been thinking about our HIV community as we navigate COVID-19 in what's an uncertain landscape for ourselves, for our families, for our friends, and for our community. People with HIV understand stigma and discrimination. And people with HIV understand the results of inaction. People with HIV also understand what happens when we are all included, what it means to be embraced by family, friends, strangers, and healthcare workers. And we know what happens when we act thoughtfully and positively, leading with science, love, and support. So I wanted to start this talk with some background and the current state of the COVID-19 pandemic, and then discuss some specific issues for people with HIV, including some frequent questions that people have asked me over the past few weeks. And so I'm going to share, can you share my slides? I think I may need you to do that, Kenyon or Jesse.
Yep, they're shared. Just tell me when to advance them. Thanks.
Perfect. So can you go to the next slide, please? So there are many coronaviruses that have been found mostly in bats, but there are 7 now that have affected humans. And I really wanted to mention this just because there are 4 that essentially cause mostly symptoms of cold. And so they are transmittable, but they are low in pathogenicity. People don't get very sick with them. But there are now 3 that can cause severe illness. 2 are SARS and MERS, which have caused very severe illness and outbreaks in the past 20 years. And then more recently, what has the unfortunate name of SARS-CoV-2, which causes COVID-19. And what's unfortunate about, particularly about SARS-CoV-2, is that it both is highly transmittable and it can cause severe disease. Next slide, please. So this map just shows that COVID-19 has affected most of the world, although its severity and the magnitude of the number of people that have gotten SARS-CoV-2 is different in different countries. It is spreading throughout the entire globe, and that's why it's been called a pandemic. And what we are seeing is that there's there's no place that is essentially immune from the virus, similar to what we've experienced with HIV in the past, is that you have to address it head on. You can't hide from this virus either. Next slide, please. So this is just showing the number of new COVID-19 cases in the United States. What we started to see in the beginning of this year is a few cases, and now what we're seeing is an exponential increase, really striking many different parts of the country all at the same time, with tens of thousands of cases in just the past few days. Next slide, please. And this map just shows the kind of the relative increase in the rate of these infections per population in different parts of the country. And so you can kind of see where it's increasing most in the past few days. And what we're seeing is in the Northeast and in the Southwest and Northwest, there's some particular areas of increase, but you're also seeing spaces throughout the country that you might not have thought about, counties that are seeing increases in COVID-19. Because it is spreading to many different communities. And because its incubation period is a median of 5 to 6 days, it spreads before people become symptomatic. And then we, if we wait to put in precautions until we've noted it, that people have illness and are diagnosed with COVID-19, essentially you're waiting too late. Next slide, please. So I wanted to highlight here that there seems to be kind of two factors with severe disease. One is underlying illnesses, and people with underlying illnesses related to either immune suppression or pulmonary disease or diabetes or other things are particularly susceptible when they get SARS-CoV-2 to have severe disease. But also age. Age seems almost independently to be associated with severe disease. And you can see here in the table on the left that it really starts to see an increase starting at about age 55 of a doubling of mortality rates, which then goes up quite rapidly in terms of severity up until over the age of 85. And this, which we can talk about later, is really an important issue for people with HIV, primarily because about half of people with HIV in the country are over the age of 50. And so the potential, if one does get SARS-CoV-2, to have severe disease is higher than for others. And so taking preventive measures is particularly important. Next slide, please. Another question that people have often asked is who is able to actually transmit SARS-CoV-2? Is it, do I have to be ill to be able to do it? What we're finding is that in the left is actually a graph that shows that as you get older and you have the virus, you have higher amounts of the virus in your oral secretions. And this is a log curve, so it's really a 10 to 100-fold increase as one gets older. But at the same time, we've detected virus in oral and nasal secretions from people who are asymptomatic, people who are pre-symptomatic, meaning that a day to 3 days before they become ill, people who are mildly symptomatic, and then people who are very ill. And epidemiologically, there's an increasing evidence of a role for asymptomatic transmission to actually be spreading the virus in communities. Next slide, please. So this is where the concept essentially of flattening the curve, and I've added shrinking the curve, because flattening the curve means we delay the onset of illness so that we don't overwhelm our healthcare system, but also we can shrink the curve, meaning we can have fewer people who actually become ill. And that's part of the goal of what we would like to do over the next few months is have as few people get sick as possible. And that allows us to prevent the spread of the infection, but also to potentially develop treatments or a vaccine. Next slide, please. So primarily what we have right now are non-pharmaceutical interventions, and they work. You can do things by staying at home. We have had school closures. In every state in the nation, people are teleworking, as we are for AIDSWatch, and then people are avoiding gatherings. And all of these have been shown to be quite effective, especially together in different countries and in cities in the United States. Next slide, please. And this map just shows, as of last week, states and tribal and local areas where there have been regulations and recommendations for staying at home. And that's increasingly the case throughout the country, and it's aligned with the recommendation that we have restrictions for the next month to attempt to both flatten and shrink the curve. Next slide, please. So I wanted to really highlight that social distancing policies, they saves lives and money. There are different models, but for the US, projected benefits of moderate social distancing for 7 months in one model from the University of Chicago saved about 1.7 million lives in the United States, and showed that you actually saved money at the same time that you saved lives. On the right, a New York Times hired some modelers to do a similar analysis, and showed that compared to social distance for 14 days, if you social distance for 2 months, you can see that the curve is dramatically decreased. It's flattened and it's shrunk. And we do have countries that have implemented these kind of policies both before the virus took hold and were able to prevent it from spreading in communities in their country, but also a country like China, which had a massive outbreak in both a city and a province, but was able to control it after that. Next slide, please. So potentially there would be large benefits to effective treatment and a vaccine. And I think many of us in the scientific community are hopeful that, that both will be available in the future. Theoretically, an effective treatment could prevent severe illness by treating people early on, could reduce transmission because it would lower the viral load. And also it can be used for potentially for prophylaxis. So if people are exposed or potentially exposed, it would prevent a person from actually getting infected with a virus. In terms of treatments, one that has been used in several different countries is convalescent plasma. People who have been infected with the virus and recover, their antibodies have been used in other people who are sick with COVID-19, and there seem to be some preliminary indications that people improve with that treatment, and there are ongoing studies right now. There are also new and existing drugs that are that are being evaluated. One is certain antiretroviral therapies, which I'll talk about later. Chloroquine and hydroxychloroquine, which are drugs either used for malaria or for some connective tissue diseases. Actually, it seems also in some trials, if you can go back at it, it seems also to be potentially effective, and those are ongoing. Remdesivir is a drug that was initially developed for Ebola, but also seems to have in the laboratory some efficacy against coronaviruses, is also being evaluated. And then some kind of anti-inflammatory agents that work against the immune reaction that seems to cause some of the problems associated with the virus itself. And then lastly, vaccines. I think people know there are many different companies that are working on vaccines right now, and they are probably going to take longer to develop and test than some of the treatments, but they would be an important public health benefit. Next slide. So some of the questions that people with HIV have asked is, are people with HIV at higher risk for infection or getting severe COVID-19 disease than other people? And I think the answer is, we don't know now because the data aren't in yet. But theoretically, if someone is immunosuppressed, there are some associations with having more severe COVID-19 disease. So if someone has a low CD4 count, they could potentially be more at risk for severe disease. At the same time, if it turns out that some of the medications that are used for HIV actually are effective in preventing infection, then one could see them as maybe being beneficial too, but that hasn't been shown yet. So I think we don't know the answer, but it would be prudent to take extra precautions as we would be recommending for people who are older or have other kind of underlying diseases. What can people do with HIV? I mean, people with HIV do for protection. I think the same measures that we would recommend for others seem to be effective. And as people know, it is a respiratorily spread virus, so keeping distance of at least 6 feet from others can be helpful. But also washing hands frequently it has also been shown to work for other viruses similar to coronaviruses. And I think in general, what our community is doing also benefits people with HIV. And we as a community itself can also look after each other. So can HIV medicines or antiretroviral therapy treat COVID-19 or prevent infection? That really isn't known yet. There's some evidence in laboratory evaluations that some of the medications we use can be beneficial. There's one randomized study that was just published that looked at lopinavir-ritonavir. It did not seem to indicate efficacy in that study. It was small numbers, and people are still evaluating both that combination therapy as well as others to see if it's effective. But right now, there would be no recommendation to change your antiretroviral therapy, hoping that it might be effective or not. But we do hope that some of these might be beneficial, or other medicine will prove itself to help people with HIV avoid infection with coronaviruses, or help anyone else because these drugs have been shown to be safe. And then, are there any shortages of ART or PrEP that might be expected? And up to this point, no one, the FDA has not reported any shortages of these medications, but is keeping an eye out for them because it would be problematic if that occurred. And there already, companies are aware of the potential and the need to ensure that there's an adequate supply. Next slide, please. So what are our kind of specific recommendations for people with HIV? One is really just to make sure you have an ample medication supply, ideally 90 days. I think initially we were thinking 30 days, but really the time for staying at home and avoiding healthcare settings as much as possible really is longer than we had initially thought. And I think it's important that people somehow arrange to have a long-standing supply of medication just in case their need to avoid going to a pharmacy or a clinic for more than a month. The second would be to, hoping that vaccinations are up to date, and if you do go to a clinic, to make sure that that you are vaccinated. Can you go back one slide, please? Thanks. The other is to establish a plan for clinical care if you find that you are either quarantined, meaning that you potentially were exposed but are not ill, or isolated because you actually are ill with COVID-19 and you want to avoid contact with others. Telemedicine is increasingly being used by clinicians and patients, and really has found it to be quite useful. And then many physicians who had previously avoided online communication, sometimes because of insurance issues, are now finding that insurance companies are more willing to cover connecting with patients through online portals and either through email or direct video. The other is to really think about your social network, and this was raised by others in the beginning of AIDSWatch, is really that we want to maintain a social network and socialize distantly, really learn how to connect with people, ideally as frequently as we would when we were actually seeing people directly, because it's really important to maintain those connections. And then lastly, just with healthcare providers, thinking about weighing the risks and benefits of attending or not attending a clinic or hospital visit. If you're sick, you do need to go into the clinic, but it's best if you're not, to avoid going into those settings. Next slide, please. So there are places to get guidance for people with HIV. We are continually updating it. Our center is particularly interested in making sure that we do that. So CDC both has a website where we have information what people with HIV should know, particularly about coronavirus, and then NIH's led guideline panels also put out interim guidance, and they'll be updating that as well. Next slide, please. Right, so I've put here just some web pages that you can go to for more information. The first one is essentially CDC's coronavirus webpage, which has a lot of different links, both for individuals and practitioners. We also have CDC info where you can actually send in email questions or call. And then the last thing here is just a coronavirus self-checker tool. It's essentially a bot that you can put in symptoms or other aspects of your situation, and it could give you some information based on that about what you might want to do. And so I just wanted to say that I believe, we at CDC are charged with protecting the nation's health, and that's challenging at this time. We don't have the answer to every question, but we have confronted large problems together in the past, and we have overcome them. And please know that wherever you are in this virtual world, we are with you. Thank you.